The Minister of Health, Dr. Osagie Ehanire, says to ensure oxygen sufficiency, the federal government plans to establish over 100 oxygen generation plants across the country. He said this in Abuja during the 17th edition of President Muhammadu Buhari's administration scorecard series. On the containment of the pandemic, he said the federal government of Nigeria, through the National Primary Healthcare Development Agency, took several proactive actions to vaccinate Nigerians to achieve herd immunity required to interrupt COVID-19 community transmission in the country. Ehanire also said that to ensure access to emergency services for all Nigerians, the National Emergency Medical Treatment Committee set up the National Emergency Service and Ambulance System, commissioned in October 2022.
We have been able to set up and revamp infrastructures that didn't exist before, such as isolation centers and treatment facilities across the whole country for infectious diseases. Training and retraining of all cadre of relevant health workers. A lot of them gained far greater experience. We also have the establishment of molecular laboratories at every federal tertiary hospital and the construction and equipping of 10-bedded intensive care unit in every tertiary hospital. Those are all great achievements. And then also, as we realize in the course of COVID-19, the importance of oxygen. So the oxygen plants we had in the country before were less than 30. Many of them were not functional. Now, the first thing we did was to get support to activate the existing oxygen plants and then to build new oxygen plants. The federal government built one oxygen plant per state in every one of the federal institutions. And later on, we were able to get support from Global Fund and from UNICEF to further build more. Today, we have over 80, 90 oxygen generation plants, beginning from less than about 30 functional before. And we are going to have at least one oxygen plant in every senatorial zone, so that we have over 100 functional oxygen plants. I will make sure that oxygen is available throughout the country. We have full oxygen sufficiency, both for private hospitals and public hospitals, even for primary healthcare centers across the whole country. And the question of oxygen not being available will now be history.
He also spoke on brain drain and how to handle it.
What we are doing about it, first of all, is to do everything we can to improve the conditions of service. We have improved the hazard allowance. We are looking at how to improve the remunerations. But we are also looking at how to now introduce a better form of performance-based remuneration, so that doctors don't just receive simple grade-level salary, but according to the work that they can. So we try to measure performance and let people be happy that they have been properly rewarded for what they have done. Right now, a lot of doctors don't, and nurses too, don't feel they're properly rewarded for the work they're doing. So that will help a lot.